Cora, I'm glad you joined me today. I wanted to pose to you one of the questions that I'm hearing so often from my colleagues, because they want to be able to answer the question to their patients. And in primary care, what we're hearing a lot and what we're discussing a lot is, are there certain patients who we worry more about giving the viral vector vaccines because maybe they're more likely to get this syndrome?
It's a very logical question to ask. And physicians actually in the European Union and in Germany looked at the cases that presented with this rare clotting condition, where you end up with clots and low platelets. And they were not actually able to find any specific risk factors in this population other than being younger, so people under 50, and being within 4 to about 20 days after the vaccine. And the mechanism that seems to be triggering this is some kind of antibody against a protein called platelet factor 4 that's on the platelets. So then you end up using the platelets. So with a clot, you have low platelets, platelets being clotting cells in our bodies. And the mechanism is somewhat similar to something that had been described before, which is the heparin-induced thrombocytopenia.
Yeah, it's interesting, I guess, to think about it as being similar to HIT, because I guess we know that HIT itself is more common in younger people too, just like where we're seeing this thing happen. And it's interesting to think we give heparin all the time, and we don't talk about this sort of 1 in a million, a little less than that, obviously, event of HIT, but we do watch out for it and we know how to treat it. And I think it seems like it's come to a similar thing with this kind of vaccine. We know how to watch out for it now. We know how to treat it now. We know what it is now. But then I get all these questions. I've heard it dozens of times in the last week. My colleagues want to know, oh, should we recommend to people to take aspirin or something else to prevent this syndrome?
Yeah, again, I think that's a very logical thing to ask. And it seems that the best treatment for this is an antibody to the antibody. So they give something called IVIG to mop up these antibodies and kind of release the platelets. And then on top of that, there is usually a blood thinner that usually doesn't work directly on platelets. So it doesn't make a lot of biological sense to me that using anything preemptively, so before this happens, is actually going to prevent it. And they certainly don't think there is any medication that we can go on after the vaccine to stop this from happening, because it seems to be some kind of an immune response to the platelets. So, as tempting as it is for people to walk around with aspirin in their pockets, there doesn't seem to be a role for it right now post-vaccine. The most important thing that people can do is if they develop any symptoms of this rare blood clotting condition, to actually seek medical attention.
For sure. That's what I've been counseling people as well. And I build on it by saying, this event is happening, let's say 1 in 200,000, give or take. If we give 200,000 people aspirin, we're going to cause a whole number of GI bleeds and likely not even stop this syndrome even once, because that's not how aspirin works. So it doesn't seem like a good bet to me to do that. At the same time, I always want to add in the UK, we now have pretty clear evidence that this particular, the AstraZeneca viral vector vaccine has saved tens of thousands of lives. It's highly effective at preventing severe illness. And, we make choices about taking on minute risks all the time when we feel confident about the benefits. And I think that's, for most people who are at risk of COVID, that's the situation we're at now. I know you also told me that for people who have risk of COVID, of blood clots, they're at risk of getting probably, worse blood clots if they get COVID. So all the more reason to get vaccinated.
Yeah, exactly. Here we are in this third wave, more variants than ever before, more younger people in ICUs than ever before. And we actually have something that can take off the edge off of our own, mortality and fatality risk with this disease, which is the vaccine.
I hope people make the right choice going forward. I know we'll keep getting more questions, and I know you'll keep being here to answer them.
Yeah, thanks for having me.